I'm Sue Barta here at the Fox Valley Plastic Surgery Vein Center. We are a nationally accredited vascular center. We treat varicose vein disease. We see all types of patients with venous reflux disease. I am the registered vascular sonographer, and I will bring patients in for their first screening ultrasound, help with the diagnosis of the venous reflux disease under ultrasound. I will go ahead and help the doctors also with the procedures for venous reflux disease and varicose veins. I will also help with the follow-up ultrasounds that we do every 3 months and 12 months until the patient's treatment is finished. Today we will be here with Dr. Duback and his patient Melissa. We'll take you from step 1 down to the end process of her treatment of her varicose vein disease, and we'll let you know the procedures she's had. She'll also tell us the symptoms that she had prior to the varicose vein treatment and after.
I'm Dr. William Duback from Fox Valley Plastic Surgery. I'm here today with Melissa, who was referred to us by her primary care physician to treat her varicose veins. Melissa, can you tell me a little bit about what kind of symptoms you were having before you saw us?
To stand at all was horrible. I'd have heaviness in my legs, just aching inside of my legs. It was very, very painful to stand for long periods of time.
So with those symptoms, then we evaluated Melissa with an ultrasound to determine the anatomy and the function of her lower extremity, varicose veins. And after we had done the ultrasound, we could develop a treatment plan. And the treatment plan we had for Melissa was to first initially ligate or tie off the vein up in her groin crease. And then after we had reduced the blood flow in that vein, we accessed her vein down in her ankle and passed a laser catheter from her ankle to her groin crease, where we had tied off the vein and ablated the vein with the laser fiber. Then with some of the follow-up varicosities, we treated them with a sclerotherapy done under ultrasound guidance. And during that procedure, can you tell me a little bit about your experience with that?
There was very minimal pain, very minimal recovery time. I was back to work the next day. I mean, there was really nothing.
So it wasn't a lot of downtime, because this was an office procedure, correct?
Right.
And we did it under just a local anesthesia and a little oral sedation.
Yeah.
And so your recovery was very prompt. Then we had you come back for some follow-up ultrasounds at 1 week to assess the treatment. And then we had you come back at 3 months and then again at 9 months. And here you are about a year out from the procedure, and how do you feel now?
Feeling wonderful, 110% better.
I'm back with Melissa, and we'll be demonstrating the ultrasound that we typically would perform at 12 months. So I take a look at Melissa's leg. We can see her deep system, her common femoral vein, and her common femoral artery. We can come back to where the great saphenous vein, the vein that was treated on Melissa, would come into the deep system. And as I take a look down her leg, the vein basically disappears. You no longer can see the vessel on Melissa's leg for her great saphenous vein. That's the typical results we find at 12 months. The vein is no longer even able to be appreciated or seen. We see patients on a daily basis for varicose vein disease. We have upcoming vein seminars, and you can sign up by our website, or you can go ahead and call the office. The next vein screening and seminar is December 18th.